Good morning. Today's guest is a friend of mine from a long time, I think, Jessica Richards. And Jessica actually beat her breast cancer, I think 1.5 times. She'll probably tell you more about that. And she's here today. Good morning, Jessica.
Morning, Chris. Morning, everyone.
Give us a few tips on how to do it, because that's what this show is all about. This show is all about giving people tips and help and things they might be able to do to actually improve and increase their personal odds of survival. That's all this series is about, but it's been getting more and more successful each week. So let's kick off. You basically, can I ask you a few basics? When
Yeah, absolutely.
did you first get this? How many years ago?
I was diagnosed. I think I had a misdiagnosis 2 or 3 years before, because I had the symptoms and everything, went through all of the tests, and what had been a jelly sort of lump on one breast, once they did the biopsy, I thought the breast changed shape. Well, it did change shape quite dramatically, but then I got the letter from the hospital saying, no, we're very pleased to say that, you know, they're just benign, and if you want lumps removed, you can, but otherwise we can leave them be. So stupidly, I left it. And then so that was about 2005, 2004, 2005. 2007, I thought, I mean, my breast was very out of shape. And I got my mammogram, you know, you get when you're 50. So I went for that, and I was pretty certain I was going to get a recall. And I did get a recall. And when I went back up for the recall, which was in Bedford, and it was in like a clinic place. It wasn't inside a hospital. It was a specialist unit for those that have had recalls. And the lump then had become like a stone. It was about 3.5 to 4 centimeters, but like a stone. And they tried to do a biopsy on it, a core biopsy, and she was leaning on the needle trying to break this thing open, and did that about 5 attempts. And in the end, I said, I don't feel safe with this. Can you stop? And she says, well, these are safe. And I said, look, the one thing I know, when I was a kid, we used to go out for walks with my mother all the time in nature, because we had no money. We never had holidays, but she made sure we went out all the school holidays. We did these long walks because there was nothing else, you know. And whenever I saw in nature, something was closed off. It was closed off for a reason. So it might be a mushroom or fungus that was full of spores. It might be some growth on a tree that was full of insects or eggs. And I said, I don't want this broken open. Well, they couldn't break it open anyway. And I think that saved my life.
So they never told you whether it was estrogen driven or anything like that? They couldn't?
Yeah, I did get that. And then they took cells from the outside of it, and the cells showed it was 8 out of 8 for estrogen and progesterone driven.
Yeah. Okay.
I then went to the Royal Marsden and had a lymph node biopsy, because I'm big on, I have a foot in both worlds. I mean, I've been in practice in Harley Street for over 30 years now, but I'm big on both worlds. I want to know the diagnostics, because only when I know what's going on can I make decisions. And I went to the Royal Marsden because I heard they were doing a trial there of doing radiation at the time of surgery, which is basically an Osner machine, which was installed later on. And they said to me, oh no, we're not doing that trial at the moment, and you're in a very serious situation. You can't do things like that, etc., etc. Terrifying stuff. And I had a lymph node biopsy, which was as a day patient. They found 3 lymph nodes, 2 sentinel nodes and 1 non-sentinel. In one of the sentinel nodes, there was 1 cell. In another sentinel node, there was a micrometastasis, so a microscopic cluster of cells. In the 3rd lymph node, which was non-sentinel, there was nothing at all. So they said to me, well, you know, this is, you can't cut corners with this, you know, we've got to...
It's spread. Do you feel they work off fear a little bit?
I felt it was, at the time, I was under great pressure. I interviewed several surgeons, consultants. I went to different hospitals, and I felt very much it was time pressure. You got to do this. It was very much fear-driven, coercion, almost threatened, not deliberately. No one was actively trying to threaten me, but it was, if you don't do this, you won't survive. You can't waste time on this. You can't cut corners on this thing. You've got to do this now. And on it went from there. Even with treatment, you only have a below average chance of surviving beyond 5 years. So
now, I did my homework on you, and I did see one interview where you were talking about how you made this a personal project because you're used to dealing and advising very senior people. So you thought you'd do the same to yourself. Is that right?
Yeah, well, I had no choice. My life was on the line. And if I was going to have a team around me, whether I survived it or whether I didn't, I needed to make the best decisions and get as much information as possible. In the military, they do it, they call it appreciating the situation. So what you do at first, you appreciate the situation and get as much information as you possibly can within the time that you have available to get that information before you start.
Did you do this all yourself, or did you have a buddy or someone working with you at all, or you did it all yourself?
No, I was completely self-driven, but I incorporated people into the team because at the end of the day, whatever decisions are made and whoever makes them, there's only one person that has to live with them or not.
Absolutely.
And that was going to be me. So therefore, in my case, I want to be the one that makes those decisions. So at first, I thought I'm going to investigate everything because I'm very much involved with holistic treatments. To me, that makes sense. So that means allopathic as well, surgery. Let's have a look at all of it, the whole picture. What was on offer?
But you eschewed all orthodox medicine in the end, and you just went natural, didn't you, the first time around?
Absolutely. Well, I've never had any surgery or any drugs.
So it was the first time around. It was diet and IVC, wasn't it? If I remember rightly.
Yeah, diet, nutrition, IVC. Because what happened there is I was going to have, in the end, I decided against chemotherapy and all that because that wasn't in my best interests. And I decided on surgery and then carry on with everything that would destroy the cancer environment in my body and support my immune system. That seemed to me the most logical, obvious way to move forward. And I had to make the decision based on, if I'm not going to survive this, then I want the last year or two of my life to be as civilized as possible. If I'm going to survive it, then I don't want to have to live with serious physical damage, because they warned me I would become a heart patient, I would be disabled and all the rest of it. And I thought, well, I didn't start off like that, you know. So,
That's right.
and then I only had a below average chance of going 5 years. So they were going to throw everything at me.
So when you did the diet, did you give up all meats and fish or whatever? I mean, what was the diet?
I didn't eat meat anyway. I've not eaten meat since I was a child because it's never been a thing of mine. I've not been able to digest it. Always felt horrible afterwards. So what I did, I was going into preparing myself for surgery, because I thought I'd rather it was out than in, and then I'll do the clear up afterwards. But I'm going to prepare myself for surgery and make myself as anti-cancerous as possible, which is another reason why I didn't understand they wanted to throw a load of chemotherapy at me before surgery. I said, well, why on earth would I want to destroy my health and my immune system before I'm having major surgery? I know I'm going 9 rounds with Mike Tyson. I want to be fit for that. I want to be in the gym working out. I'm not going to go in and out of hospital being poisoned. And that was another story, which I'll go into if you wish, and how I made that decision not to do that, but how they tried to coerce me into doing that at the threat. And I want to make this clear at the time, when we're talking 13 and a half years ago now. But what forces most people into making a rash decision, was a red flag to me, because what happens when you're diagnosed, you immediately go into fight or flight. So you are physically, biologically unable to make rational decisions, because all of your energy is going into your heart and your limbs so that you can fight for your life or run for your life. But at that same time, you don't need to be thinking rationally, because that's not how we're designed. But at the same time, you're expected to make some very critical and complex decisions on something that you really don't know enough about. So the best single most decision I made, the number one decision I made, was to take a few weeks out to get used to it and get over the initial shock, so that I could think straight and think rationally. Unless you're in an emergency situation, which very few people are, my best decision, and I think saved my life, I took time out. So when I got to the chemo side of it, I said, I'm not understanding why it's going to be in my benefit to have chemo first. And they kept throwing this, oh, it might shrink the tumor and you can have less of a surgery. And I said, listen, at the time I was 50 years old, you know, I said, I'm 50 years old. Why would I do that to myself and put my life on the line and even kill myself for the sake of having a better pair of jugs at the end of the day? I don't accept that you have the right to make that evaluation for me and prioritize that. It's not my priority. So then they said, well, you know, if you don't do this, you won't survive. So it's done in two levels. You'll die without it. Then the other side of it was, but if you do it, you've got an 85% chance of a cure. So when someone's in a state of shock and fear and they say you're going to die, and then, but this could save you, you've got 85% chance. And I know that they genuinely believe all this. No one was lying to me or threatening me, but I was talking to people who seemed to be completely brainwashed.
Yeah, it's true. A great majority of the patients, well, I get out of England. I mean, England's a very different country to other nations, completely different in America. But certainly the story you're telling is pretty common in Britain. So when you changed your diet and everything first.
I just want to say this one thing before that, Chris, of how I decided against what was going on. When I was told that you will die, you won't survive if you don't do this, but if you do it, you've got an 85% chance of a cure. So that threw up a red flag where most people will be so afraid. And I'm not saying I'm not one of those. You think, right, I'll do it then, I'll do it, whatever the cost. And I said, well, I'm a bit confused here, because how do you know that if I don't do it, I won't survive? You can't possibly have studies to show that, because most people who don't do chemo don't go to hospitals. So you wouldn't have even met them, let alone know that they didn't survive. And on the other side of that, I'm confused, because you're saying that I've got an 85% chance of a cure. Well, in my experience, and I don't know if I'm getting this wrong, there isn't a cure for cancer. So I don't understand how I have got an 85% chance of a cure. And I then said, I don't understand then. You need to explain to me what your criteria for a cure is, because I'm sure it can't be the same as mine. And he said, well, our criteria for a cure is if you are still alive 5 years after your initial treatment ends. And I said, well, what kind of science is that? I said, I'm only 50. And I said, so what you are saying then, I said, I've got a few friends, I've got three, I had three at the time, who survived 5.5, 6 years. So I said, your science then is saying that you are including possibly tens of thousands of dead people in your stats as cured. And I said, that's not rational. I said, that's not even sane. And I'm not about to bet my life on that kind of science. I said, I'm not an academic, I'm not a scientist, but I know how many beans make five.
I know.
And I'm not going to bet my life
forever
on that.
Talking about survival, and they don't define survival unless it's a piece of research about the actual stats of survival, which is 5 years or 10 years now. but almost every drug they talk about increased survival, whatever, you know, or survival on its own. And they're very misleading words, because survival to the drugs companies and cancer research is just not the same as it is to my patients. I want all my patients to be cured. I actually do, you know, and that's what we try to get to. So tell me, you decided to do IVC.
Well,
Why did you choose IVC?
I went to see Dr. Andre Young-Snell. He'd been recommended to me because he's a medical doctor. He works in the NHS for 20 years, but he works with integrated medicine, which was ideal for me. I had 3 to choose from. I called them all up, and Dr. Andre lives a long way from me, but I resonated with him. Completely genuine person. Made an appointment to go and see him. And he doesn't recommend one thing or another. He just listens and helps people go ahead with their choices with the right kind of recommendations for the treatment that they've chosen. He doesn't tell people what to do.
Absolutely.
So I said to him, look, this is what I've decided at the moment. I want to do the surgery because I'd rather it was out than in, because I've got a huge tumour in there and I don't think I've got that much time before it starts going walkies. Told him the outcome of the lymph node biopsies. And I said, I would like to make sure that I'm very, very fit before surgery. I do understand a lot about diet, and I know that I need to really specifically aim that now, not just as a healthy diet. I've got to go on an anti-cancer protocol, and you're the person who can best inform me on that at the moment. And the nutrition side of it. And then afterwards, I'd like to come back, and I've heard about the intravenous vitamin C, and I'd like to be able to do that to clear up after the surgery once I've recovered enough. He understood that, and I went on this protocol. And within about 3 weeks, I don't think it was any less than that or any more than that, it's about 3 weeks, the tumour suddenly went to jelly. And I got a bit worried. I phoned him up and I said, Dr. Andre, I said, this has changed. You know what they keep saying, any change, you must report to us. And Dr. Andre said, well, that happens a lot. He said, in this kind of situation, he said, that's the tumour has stopped progressing. He said, because of the diet and the nutrition that you're on. He said, but don't take my word for it. He said, and don't keep talking to alternative people, because they'll all say, oh, that's brilliant stuff, that's great, and keep going on. He said, go to a hospital where they don't know you and ask for a scan so that you can get that side of it. And he recommends another hospital, which is near me in Cambridgeshire.
Yeah.
So I got my doctor and he got me an appointment there. I was treated extremely badly there, not because of the hospital and not because of the profession. I just had someone to see who obviously has a personality defect, but it was nothing to do with the hospital or the good people that worked there. There was just this one individual, which you can find in any profession. And he kept saying, you won't make it. Why did you go to elsewhere first? We're the best hospital. Real nonsense stuff.
I get people like that. I get people who are told, if you go naturally, you won't make it. You know, you're going to die.
I'd left it too late. You're going to die. This was September the 7th, and I was diagnosed on May the 11th, so 3 months later. So I remember thinking at the time, you know, you're a lot closer to death than I am, because I felt so angry at being spoken to like that, because I'm an intelligent person, you know, and I don't expect someone like that to be speaking to me like I'm some kind of a moron and threatening me like that. But anyway, I said nothing because I wanted to have this scan. I went in to have the scan, and the gentleman that scanned me, and there was a nurse there, he was in the middle of training to specialize just in all kinds of scanning techniques. So this was his real area of expertise and interest. So I said to him, he was very nice, I said to him, is there any way that you can tell if a tumour is still invading or not? And he said, sometimes you can. He said, let me have a look. And he showed me so that I could see for myself. He said, right. He said, that's where the tumour is. And it looked a bit scary because it looked that close to my lungs, you know, as it laid on my chest, because I'm quite a skinny person. It was really close. And flip. I don't know if I wanted to see that. And he said, as you can see, the tumor is lying completely flat in the tissues. Now, I wasn't sure what that meant because I don't read scans, but I can read faces. And I looked at him and he looked at me and he said, and he smiled, he said, that's a very good sign that your treatment's working. And the nurse said, yes. She said, normally they invade from the outside like a crab and they die from the inside and keep invading from the outside. She said, that's doing nothing. She said, I've seen enough of them. She said, that one's doing nothing. So I thought, so I came out. The other idiot still kept having a go at me and saying, and he wouldn't pass on my pathology to my doctor or anything. He said, no, I want you back here and all the rest of it. Well, I didn't. And it took me 2 years to get the pathology from him. By hook or by crook, I got it in the end. And that was via someone else's secretary at the hospital. When I told her what was going on, she said, leave it with me. And within 2 hours, she got it. So I don't know even to this day if he knows that I got that pathology, but that he had no right.
For his sandwich and she nicked it.
Yeah, absolutely. She went in and got it. But that was completely illegal for him to withhold my pathology like that when I asked him.
Everybody's entitled to all their pathology within 10 days of asking for it.
Yeah.
The law.
2 years, took phone calls and letters from my the consultant that I eventually ended up with, and still nothing. And in the end, as I say, after I phoned up and she said, oh, that's not right. She said, leave it with me. Within a couple of hours, she got it for me. So I don't know to this day if he ever found out, but he was determined, I'm not having it. I've got to go back and get it myself. So he could have another go at me, you know, but.
So what did you do then? You went back to Andre, and he used to write for Icon magazine, actually. You went back down to Andre, and he's in Brighton, if anybody wants to know. And you decided to go for the IVC.
Well, I said to Dr. Andre, well, I've decided then, I thought, well, I went back to the hospital. They said, oh, you know, it's changed. You know, this is getting really serious now. You've got to have this. Well, I think we have to do a slight adjustment. They were going to do a lumpectomy with a reconstruction because it would have been a big lumpectomy. But he said, oh, this is completely different now. We've got to do a mastectomy and you've got to do the chemo and all the rest of it. And, or we'll make a slight, a slight adjustment to the surgery, you know. I said, well, I don't see that that's a slight adjustment. I said, one's with a tip and one's without a tip. I said, it's a bit more than a slight adjustment. I said, especially if it was on you. Well, anyway, then I found another consultant and I said to Dr. Andre, I'm very concerned about having the surgery now because they're not going to get clear margins because it's not a stone anymore. It's undefined. And if my treatment is at least holding it in stasis, then I'm not sure I want to interfere with it at the moment. So I said to them, I'd like to delay the surgery. And in the meantime, I'd found another consultant who was a consultant of another patient of Dr. Andre's. And that consultant was very supportive in the sense that he included Dr. Andre on his letters and everything and conferred with him, you know, on what was going on with the patient. And this consultant was completely mainstream, but he also supported people who wanted to make other choices because we had nowhere else to go. And he's mentioned in my book. And when I asked him why he agreed to monitor me, and he said, because the sat-nav doesn't always take you to where you want to go. It's not always right. And so it was a sense of fairness that those who want a different route than the one that's on the sat-nav, you know, deserve to be supported out of fairness because the sat-nav doesn't always get you to where you want to go. And that was the arrangement that we had, and we shook on it. I asked him if he'd monitor me. And he said, right, on the agreement, he said that if your treatment doesn't work in the way that we hope it does, that we will consider other options that the wonders of medical science may have to offer. And I said, well, that's fair because he had to, it can't just be all the ball in my court. So we had that arrangement. So he agreed to be my consultant. But what he did say, which was very interesting, both the hospitals I've been to beforehand, which are university hospitals, said, both agreed, oh, they never find anymore that people had the lymph node results that I had, but I still had to have all the lymph nodes removed for safety. They both said that. And I couldn't understand that. I said, well, if you never find any more, why do you want to take them all where I need them most? Oh, because it's safe. It's to be safe. It's to be safe.
No evidence of that at all.
Last consultant, he was the consultant who was the first one in the Royal Surrey that they actually had the OSNA machine there. He said to me, as far as the lymph nodes are concerned, he said, I actually agree that, he said, I've done the biggest lymph node trial in existence so far. He said, and it was over 1,000 surgeries at the time. And he said, we never find any more in people that have the results that you had. He said, so I agree you should not have any more lymph nodes removed because it isn't safe. Mm-hmm. And he said, however, we should remember that the enemy has visited and bear it in mind. And I thought, well, that's the first person that had the qualification and experience to give me any advice at all. So that's where we went. So I then went to Dr. Andre. I said, I'm not doing the surgery at the moment. I'm going to like to go straight on to the intravenous vitamin C, which I did. And I stayed at the last hospital with this consultant, Mr. Kissing. And I was being regularly monitored with scans and examinations at the Royal Surrey County Hospital. I have records of it all. And they told me there, and they could see it on the scan, that that tumour was breaking down in exactly the way a tumour breaks down with chemo, except, of course, I wasn't having any of the damage that you get from chemo. And that's the way it went. But money was an issue. You know, it's an expensive process. You're paying for it all privately.
Can I ask you how you had your IVC? Did you have it like once a week for 6 weeks, or how did you have it? People
in those days, now things have changed since then, and I think
yes.
Dr. Andre got adjusted protocols now. So I was one of the early sort of patients in that 13 and a half years ago. And in those days, I did 6 days a week for 3 weeks because I only had the money to last for that. And then I went down to twice a week for several months until it just became financially unviable. So that was the only drive.
Quite a lot. They used to use it at about 45, 50 grams. And I was talking to Thomas Lodi and Julian Kenyon about this, and they're now up to 85 grams.
Well, we were doing 75.
Giving it once every about 4 days. But Thomas was saying to me that one of the biggest issues is trying to keep the level of vitamin C high. And we were talking about how 5-FU, that was my idea actually. I said, when you have Folfox or whatever, the 5-FU is given to people is intravenously on day 1, and then they carry around a little bottle on their belt for 2 days. And he was going, oh, that's a bloody good idea. I said, just to keep it topped up. And because he said it's one of the biggest problems. They actually want to give people a really big dose, but actually somehow find a way to keep the levels up.
Well, we were doing 75 grams a day, but 6 days a week. So, you know, that was definitely going to keep it up.
Yeah. Well, I mean, the research now, they've done 2 phases of a clinical trial. I think it's Ohio. And they've categorically said after phase 2, this is with grade 4, stage 4 lung cancer and gliomas. They've shown that this stuff works and there are no side effects. And now, of course, you need to do phase 3 of the clinical trial to find out how much it works. Because if it works and gives you another 2 weeks for 6 grand, 8 grand, it's not worth it. But if you get 8 years, then it's certainly worth it. You know, that's the real big step they've got to come to next.
And I did find some people's situation was more responsive than others. So I happened to be one of those people where the tumour I had was highly responsive to the diet and to the intravenous vitamin C.
I'm going to offer a comment, which could be just a poor observation. I have a lady who's got breast cancer and it had fumigated, and she was using cannabis oil on it, and the skin had all broken up and everything else, and it was black and so on. And I said, look, why don't you break out? Literally, she had 2 days off from the cannabis. I think it was like 3 days on, 2 days off. And it was all black across the top. And I said, do two things, just humor me. I said, break open a probiotic onto the surface, because that will eat any badness there is. And secondly, why don't you use something like aloe vera, just 99.9% aloe vera or whatever, see if you can heal it. We've got it going completely the other way. So it's now gone back inside her. It's got much smaller. And what made me think of it was it's hard. And I have a theory about this, because she doesn't want any treatment at all. I have a theory about this. The body often wraps things up. So if you get a thorn in your arm or whatever, and you don't get it out, you might actually end up with a lump there. It's the body's way of protecting itself. And so my theory would be that perhaps in the early stages, you had a cancer there and your body had wrapped it up, and you
it closes it off.
Put calcification around it and just lock it. The body might lock it up and go, that's it, job done. It's not going to upset me anymore.
And I had more than one consultant that said that. One came over from the States. It was at the British Society of Integrated Oncology at one of their initial meetings, and I spoke to him about it. And he said, if it's like a stone, he said, that's your body closing it off.
Yeah.
It can't go anywhere. I had heard of several people that had theirs broken open, and it progressed really quickly after that. Mr. Kissing said that the calcification are the gravestones of cancer. He said they're cancer's gravestones, so he doesn't get too concerned.
So you had a few years where, as far as everybody was concerned, this was job done all over?
Well, I don't think it's ever, anyone can ever say job done all over, because how do you know about anything going on until you get symptoms? You just don't. Even if you've had conventional treatment, they can never genuinely say, oh, job done all over.
Well, they do say that. They do say that. And I always say to my patients, look, you just come out of FEC, T, and the radiotherapy and the surgery. Actually, now's the time to rebuild you. Now's the time to start. You've had all that treatment. Can we now start and rebuild you and get you healthier, how you should have been in the first place? So,
yeah, absolutely.
Yeah.
No,
so, all right. So, let's put it this way. You had a few years off and then it came back.
Well, it didn't really come back. What was left of the tumour was much smaller, and it was still like stone. And I stuck to everything for 5 years. And then I got the letter from Mr. Kissing, which I've been praying for, instead of the 6 monthly visits, we can leave it for a year. He just wanted to see my last lot of blood tests. Having said that, all of my blood tests all the way through have been completely normal. So blood tests aren't diagnostic, but they're a brilliant way, if you can get them, to look at a trend. So I know, although mine have been normal all the way through, if I ever, God forbid, got a spike in something, I would need to take it seriously. But mine have always been really stable all the way along. So after 5 years, during this time, I'd split up with my long-term partner after nearly 20 years. We'd known each other nearly 20 years. We've been together for 12. And both of my parents died within a year of one another. And the family sort of fell apart, as they do. So and my friends had moved away from where I live. We were all friends here, and most of them moved away. And I'd gone to the wall financially, because I work in the corporate world. Every penny I'd had virtually had gone on treatments. And then, of course, when in the corporate world, you're booked 6 months to a year in advance. Well, when they hear about the big C, you can't blame them for not wanting to do that. A couple of people deliberately booked me for the following year as a show of confidence, which I greatly appreciated. And I did do those jobs with brass knobs on. And I got to 5 years, and this is a really important mental aspect to this, because your mental attitude is everything, really. And I got the letter that came through my door from my consultant to say, I'm very pleased to tell you that your last lot of blood tests are completely normal. Here's a copy of them. And so as agreed, we will see you. Please make an appointment to see me in a year. And I thought, that moment would be, yeah, it would all be in my mind. I'd seen it. I'd be phoning up my parents. I'd be my ex's mum, who I'm still great friends with, by the way. But I'd be with my ex and we'd be phoning her up and all the rest of it. And instead of it, I was standing in my house on my own, socks hanging off my feet like they do, you know, like a pair of woolly flippers.
Cat?
Huh?
So you had your cat?
No, I didn't. Well, actually, no, my cats both died during that time as
Oh,
well.
no. Oh, no.
The two I've inherited now this year was from a friend, Tim Hancock, who died unexpectedly in May. And I've got his two 15-year-old cats.
You better not point over your left shoulder because he's walked across the back and jumped off the other side.
She's got bored. So, and I felt like, looked around and I thought, God almighty, and I suddenly came crashing down where I'd been on a mission. It was now the reality, and everything suddenly slowed down, black and white. Everyone had moved on, and I felt like Miss Havisham from the Dickens tale, Great Expectations, where she was jilted on her wedding day, and she never moved out of that room or her wedding dress or the wedding feast, and everything was covered in cobwebs. Time had moved on, and she'd stay there, and I felt that's what I've done. Everything has moved on, and I was still in 5 years ago, and I came crashing down like you wouldn't believe, and with no support. So I noticed then that this thing started to become active again, in the sense it started to involve the skin. Now, it wasn't like fungating or anything like that, but I had a little red patch where it was pulling the skin in. And I thought, oh God, here we go again. So, and I wasn't up for it this time, because what it came down to was working myself to death to earn the money to pay for treatments, to keep myself alive so I could work myself to death. And I thought, you know what? That's not a life I'm particularly interested in at all. So I thought, right, well, I've got two ways out of this. Let it happen naturally, or just take my own way out of it. And I chose the latter. I had an appointment with Mr. Kissing, and my ex's mum used to come with me. As I say, we're still great friends, me and Sheila. And she used to come in as a chaperone, because if you bring someone, a nurse doesn't have to come in. And so I used to take Sheila along with me, and went to see Mr. Kissing as agreed after the year. And this was in the January. And he said, examine me. And he never used to say a word. He just examined me. And then afterwards, he'd say, I'll examine you, then I'll tell you what I think, and then you tell me what you think. And that was our arrangement always. And he said to me, what's been going on? I said, oh, nothing much. I didn't want to say too much in front of Sheila. And he said, what's happened? I said, oh, you know, just life. And he said, we'll do the blood test. He said, would you come back in 3 months? And I said, no. And he said, please, will you come back in 3 months? And I couldn't look at him. And I said, no. And so he said to me, look, please, he said, would you, and he went on and on and on. He said, would you just think about it? So I said, all right then. I said, I'll think about it. I had no intentions of going back there, but I didn't want to miss that appointment, because I'd never missed our arrangement. I always honoured our arrangements. So anyway, as I got up to leave, we always used to do a little peck on the cheek, because that's, you know, when you're with a consultant for so many years. And that's why I do think patients should be matched with their doctors, you know, and vice versa. And as I went to leave, I still couldn't look at him, and he suddenly embraced me. And I don't know if it was for a few seconds or a minute or 1 second, I've got no idea. And he just suddenly embraced me. And I looked up at him at the end of it, and I said, do you know what, Mr. Kissing? I said, I'm going to have another go. I said, out of bloody mindedness. And he had this great big beaming smile. And he said, I said, when do you want me back in? He said, would you come back in 3 months? I said, okay, I'll put it in the diary. And he said to Sheila, look after her, won't you? And she said, oh, I will, you know. So anyway, I called him up afterwards. Oh no, I said to him at the time, I don't want the results of blood tests. Keep them to yourself. And he said, why is that? I said, because I don't think they're going to be good this time. And I've got to be mentally focused. So no information is better for me. I don't care what the results are. You are not to pass them on to me this time. That was our agreement. Anyway, a couple of weeks later, day before, he said, well, we have the results by next week. And the following week was my birthday. I said, you can call me up. Don't call me up on my birthday. You can call me up the day before. Well, anyway, he obviously forgot. He called me up on my birthday.
I remember you telling me this.
Yeah, and I'm not talking to you today. He said, well, I said, it's my birthday. He said, well, I said, I told you, I'm not talking to you today. And he said, well, I said, I'm not talking to you. So anyway, he said, well, I'll have to call you tomorrow then. I said, yes, you will. So he called me the next day and he said, I've had blood test results. I said, I told you I don't want to know about them. He said, but why don't you want to know? I said, because I don't want to get distracted. And he said, yeah, but I said, we had an arrangement, whatever the results are, you would not tell me. I do not want to know. And he said, I know. He said, but, well, what if the results are good? I said, I still don't want to know. And he said, but what if I already know? I said, well, you've just told me now, haven't you? I said, the results are good, aren't they? And he said, yes, they are. So he did everything he could to sort of honour our arrangement. But at the same time, he absolutely wanted me to know that the test results were all right. And so it was a huge relief. I mean, we battled, but he didn't back down. He kept on and on and on. Look, what if I just, you sure you don't want to know? I've only got to look at the computer. It's right in front of me, you know. And, well, what if I already know? So
you decided at this point, didn't you, if I remember correctly, that it was about time you got this thing out of you?
Yeah. So after that arrangement in January, and bearing in mind the phone call was only a couple of weeks later when he got my blood test results, because my birthday is beginning of February, oddly enough, on St. Agatha's feast day, and St. Agatha is the patron saint of breast cancer, believe it or not.
I remember I came to see you and it happened to be your birthday.
That's right. That's absolutely right. What a time. So anyway, during the time of all my research, there was a journalist called Laura Bond, and she used to write a really good blog. And the best thing about it is it wasn't every single week getting bombarded, but every so often I'd get this blog that I signed up for, and everything on there was so interesting. And she always had links to everything, to the research and the facts and everything, which I really appreciate. And it was called Mum's Not Having Chemo. But anyway, all of the stuff I'd seen dozens of times over, because I'd done a lot of research. I knew a lot about stuff anyway. And I'm just a compulsive researcher. So there wasn't anything new, except one thing stood out apart from everything else. And it was a headline. It said, "Black salve saved my life." And I thought, how come in 6 years it had been at the time, I've never heard of that? So I kept the article. I looked into it and I kept the article. So I went straight back to that article and saw that it said about the black salve. And I thought, I ordered some. I got it from South America. And then I tried to find someone in the UK who knew anything about it. Nobody, absolutely no one at the time. But an associate who's now become a friend over the years, Philip Day, I called him up because he's a mine of information, as you know, it's cancer active. And Philip Day had been doing the rounds for years, and he was an investigative journalist to begin with. And he was the one that gave me the information to do this alternative kind of route. And he found the integrated doctors. And I asked him if he knew anything about it. He said, I don't know anything about it personally. He said, anecdotally, I've had many patients on my tours that have come up and said they've used black salve and it's really saved the bacon. He said, the only person I can think of, he said, there's a guy in New Zealand called David Holden. He said he gets a lot of my research stuff and passes it over. He's a naturopath and has been working there for 20 years. If anybody knows about it, he does. I'm going to introduce you as a friend of mine. He did that. I got in touch with David. He said, yes, I've been using it for 20 years. He said, that's why I became a naturopath. I was a scientist and I got skin cancer on my forehead. They want to do all kinds of things, he said, and I was a bit concerned about the side effects and everything else. I found out about black salve, used it, solved the problem, and I just became interested in that. And I now have a naturopathic clinic that's international. Funnily enough, I'm still friends with David now. We're in contact virtually every day. And I went to New Zealand for the first time in January, and I've went to see him for the first time. So he said he would help me on Skype do this process. So I then begun that. He said, you need to prepare and get fighting fit, which I did. And I'm a very fit person anyway, but I was on a mission then. Fitness, exercise, diet, nutrition, to make sure I was super duper fit. And I made a few mistakes in it because we were doing it at such a distance, and obviously you couldn't examine me and I didn't have enough information. And this was quite a large tumor again at the time. So I began this process on the 6th anniversary of my diagnosis on May the 11th, 2011, no, 2013, I beg your pardon. May the 11th, 2013, I did my anniversary photo. I had everything here. I had all the medical stuff here, which I'd managed to accumulate. I had everything to set up, basically a surgery in my home, which I did, and locked the door. And I had a word with that tumor, and I said, this is between you and me now, because nobody else knew. I wouldn't dare tell anyone else. I didn't want anybody else interfering or thinking they know better and calling the NHS and all the rest of it. So I just said, it's between you and me now, and I will endure whatever I have to endure. But at the end of this, you're going to be gone, or we're both going to be gone. And I don't care which one of those that is. And I genuinely didn't. That was gloves.
But you gave your tumor a name.
No.
No, it wasn't you. Okay.
I would never personalize a tumor.
Okay. Okay.
It's not an entity in itself. As far as I was concerned, it can kill me or off.
We should just tell the audience that black salve is what I think people would have said 50 years ago is a poultice. A poultice. It's made out of 5 different herbs, and you literally put it on the skin on top of the actual tumor.
Yeah,
it's on the Cancer Active website. There's a whole page or 2 on it there.
Yeah, it's been around for thousands of years. But an interesting thing is, and this is from an allopathic point of view, there was a gold standard in skin cancer surgery and treatment called the Mohs technique, M-O-H-S. There are still Mohs surgeons now, and the reason they are different from normal cancer surgeons is that Mohs surgeons, and I've interviewed one at St Thomas's Hospital in London for the next book that I'm writing, and Dr. Raj Malapedi, and they differ from ordinary cancer surgeons because they do their own pathology. So they map the pathology as they go. Now they're called Mohs surgeons because Frederick Mohs, back in the 1960s, I think it was, at that time then, they don't use this technique now. They have other techniques for doing it, which is quite similar. But at that time, he used to do the first bit of surgery on the skin cancer, but not too extensively. And then he'd paint on it his fixative paste. And then every day he'd take a slither of that off with the paste and he'd put it under a microscope. And he'd do that on a daily basis until there were no cancer cells showing. when I looked at the ingredients of his fixative paste, it was black salve. It was exactly those ingredients in a solution, as we know, which was mine, of zinc chloride. And it was exactly the same herbs. The reason that he stopped doing it is because most people wanted that tumor taken out immediately, no matter what.
Yeah.
And the other reason, it was time consuming and pretty painful. But they do have similar things now. Dr. Raj Malipedi didn't know about the black salve aspect, has no experience of that. But there are other techniques that they use now for skin cancer, which is why I always recommend go to a Mohs surgeon if you can, because they map their own pathology. So they're looking at the whole thing. And they do have other creams and ointments now that there's one of them that's actually activated with UV light. You know, it's very...
There's a weed in Australia and people just take the sap out of it, just squeeze it, a little drop on the actinic keratosis, and the sunlight kills it all off. So you're absolutely right. There are several like this. We ought to say that black salve historically was more used for skin cancers. In fact, I had a lady who'd had 32 skin cancers on her body and beaten everyone with black salve. The FDA and the Australian authorities don't like it too much. But when I looked it up, I think it was almost the same time. I did a tour in Australia and I was in the hinterland behind Brisbane, right out in the countryside. And I had this lady, quite an old lady, and a man come up to me. And they said, "Have you heard of Gumby Gumby?" And it's like, you know, I can't have heard of everything. For goodness sake, have you heard of Gumby Gumby? No, I haven't. It's an Aborigine thing. It's herbs, and you take it. And at that point, they both whipped off their shirts, and they had black spots all over them.
Yeah.
And I said, and they said, it's a cancer identifier, Aborigine cancer identifier. And then they put the black salve on.
Yeah, because the black salve can be used diagnostically as because it's cancer specific. Yeah. What I do want to say to people, though, for goodness sake, if you have a breast tumor or any other kind of tumor, don't just go rushing out and whacking black salve on it without any backup or anything else. It's a really dangerous thing to do, in the sense that what I went through, and I was a super fit person, was 30 days of hell. It was basically a major surgery without an anesthetic. And what people keep doing, they keep getting in contact with me. Oh, I've already started it. And I just say, I spent months preparing for it, researching, and I had a medical backup. I also contacted my consultant and I told him, out of fairness, this is what I'm doing. So he said, well, here's my personal email address. Would you please keep in contact and let me know what's going on? And if you need my help, let me know. So I had surgeons there as backups as well.
Well, it is mildly corrosive. I mean, all 5 herbs we had anyway covered on Cancer Active, and all 5 herbs have anti-cancer properties. So that's the good news, but it is mildly corrosive. So
zinc chloride is massively corrosive.
Yeah, just tell me, so did you put it just on the spot? How did you stop it going outside the spot?
Well, the thing is, I used far too much because I didn't know any better. So I thought you had to keep applying it and applying it. So because I put far too much on, it was massively corrosive, but it was very specific to that spot. And it basically cut around, almost like a scalpel had been around that area. And I got to one point, and I was really, really under pressure at this time, because your immune system is going all out, because the way that it works, it destroys the protein sheath around a tumor and exposes it to the immune system. It's the immune system then that goes in and knocks hell out of it and kills it. Now, I realized when that had happened, because I've got photos all the way through.
I saw your photos. You showed me your photos. Amazing.
Absolutely. Absolutely. But I left it on too long. What I should have done, when the tumor was dead, and you can feel when it's dead, at first it's horrendously painful for me, because it was a big tumor and deep inside the breast. It was near the surface, but it went deep inside. It was massively painful, and it was like a big boil to touch. Nothing could touch it. It was murder. But there came a point when it felt quite numb to touch it from the top. And I thought, wow, that feels like it's dead in there. And that's when I should have salved it off with a healing salve, and then gradually allowed it to heal in layers and layers, rather than let it close quickly. So anyway, I left the salve on there for too long, which caused more scarring than was necessary and more pain than was necessary. But the interesting thing was, and I found it absolutely fascinating, that the one thing you're told to do not touch the eschar once it's formed. Don't take it off, don't pick it off, don't do anything. Well, it was so painful anyway, I wouldn't. But there were days I was in so much pain, I couldn't eat, I couldn't even wash, I couldn't do anything. And I had no help, I didn't dare get any help. But then I started to have little gaps where I felt slightly okay. I had a little bit of a reprieve. And in that time, this particular time, I would either get a shower because I was paranoid about infection, but you're much safer in your own home, actually, because it's your own germs, and your own germs will fight off any invading germs. So plus I had it sterile, like it was like surgery. And I thought, right, I'm going to get in the shower. So I got some tape and some black bin bag, and I taped it over the area so it didn't get wet, got in the shower. When I came out, I had a look, and it looked like my dressing had got a bit wet, and I thought, I think I want to replace that. And this was at a weekend, it was a Friday evening, and I thought, I think I'm going to replace that because that's not looking, I don't want to risk it coming off and getting infection in there. As I took it off, half the eschar fell off, which is the scab, and half the plug was still there. I nearly had the shock of my life, and I'm quite a focused person, but I saw inside, and it went in about that deep, which is about an inch deep. I could see inside there. It was half covered. It was a hole. It was half covered. It was like a cavernous hole. And in that half, I could see sticking in there was this, and it was a tumor inside like that. And it was white. Well, I nearly really had to keep myself together then. I thought, flipping hell, I'm not used to seeing wounds on people, and certainly not on myself. And I thought, what the hell am I going to do?
I remember from your pictures two things that left a lasting impression with me. Sounds terrible, doesn't it? I remember, honestly, folks, it wasn't like that. I remember, first of all, it going white. It went completely white. The tumor from above, the tumor went completely white. And then I've been asked to describe it before. It literally pulled away from your healthy tissue.
That was the eschar. That's exactly right. When I had this half and half, I didn't take photos, but I'm going to explain the bit you saw, which is 100% correct, is what I did at that time. I didn't know what to do. I couldn't get hold of David because he's in New Zealand, the time difference. It was the weekend. I didn't know what the hell to do. And we stupidly didn't have a plan B of how we could have emergency contact. Worse than that, I found out later it was a bank holiday weekend. So he was gone for 3 days. Yeah. So I then started to chant, remember what I was told. Just remember what I was told was, don't disturb the eschar. So I thought, right, half of it's gone. I've got no choice now. I'm going to have to replace that half. I can't remove the other half. The tumor's not coming out. I'm going to have to replace it and just pray I can deal with the pain that comes with it. I replaced the eschar. I covered it up again and prayed, but I just got on with some work. to distract myself. The pain wasn't as bad, anything like as bad as I expected. So that was a massive help. I invited a friend round the next day because I thought I'm going to need some help in case I pass out, because I need to check this thing. And I said to him, you're going to have to come up with me if I pass out, whatever, don't come in with me. I know when I'm going to pass out because I've passed out lots of times in my life, so I know the symptoms. If I'm going to pass out, I'm going to make sure I'm leaning forward on the loo, which was covered with surgical drapes and everything, because I've got more than one bathroom, so I could do that. Whatever happens, do not lift me up and do not allow me to fall on my side. Just leave me forward like that. And don't call an ambulance or anything. He was like, whoa, no, I don't want to do that. Whoa, yeah, and he wasn't going to do it. And he said, and I said, well, you're going to have to. So he said to me, well, I didn't sign up for this. And I said, and neither did I. I said, just get up the stairs. And I made him go up there. He had to stand outside the bathroom door. I couldn't believe it. I took the dressing off and had a look, and the whole thing had completely sealed and covered perfectly. So I thought, whew. So that was all right until the Monday. I thought, I'm not going to touch it now until I can talk to David. I'm going to leave well alone. Got rid of the guy anyway. And David said to me, he's never heard of that happening before, but but I did exactly the right thing. And I will say, when that half came out, a bit of pus and a tiny little bit of blood came out. So it was like, it just expunged everything.
I remember, I remember when the tumor was pulling itself away from your healthy breast.
Absolutely, like a scalpel had been round, and the tumor.
Yeah, I mean, the healthy breast almost looked like a piece of tuna. You know, when they cook a piece of tuna quickly, and it's raw, but there was no blood at all. It was just pulling away. And you said something to me at the time about, you know, basically it was 10 days to kind of for it to go white, and you then said it took 21 days in all, but the next 11 days were hell.
Well, no, it took 30 or 31 days in all.
Really?
Yeah. But it was the first half of it where it was doing its job, and the next part of it where my body was expunging it because it was dead tissue.
Just putting body pushes it out, yeah.
Yeah, and that's when I should have used the healing salve to allow it.
There's another lady in Britain called Anne Devlin, I know well, who she used black salve as well. Yeah. And four lumps came out over Christmas. And you were the same as she. She went to hospital with the lumps and said, tell me about these. And they said, they're cancers. That was right. You took it in a bottle.
As my body expunged it, and I just put dressings on it and aloe vera and kept it clean. It's colloidal silver to keep it clean, then aloe vera to help it to heal behind it. So that big hole actually started to close up and just push this tumor out. And eventually I took the dressing off, and the tumor came out onto the dressing with the remains of the salve, and it was white. You could see it was a whole tumor. I took photos of it along with a metal ruler so you could see the size and dimensions, and I put it in formaldehyde.
Yeah. In your experience then of this black salve, I know you could say it's subjective, it's only one and so on. Do you think there's a maximum size lump you could deal with? I mean, I'm talking about the practicality of dealing with a huge lump. Is there a maximum size? Because I have a lot of women ask me about black salve over the last 6 years, but sometimes they've got a big tumor. I'm always a bit wary of saying anything to.
I'd be extremely wary because, number one, we have to get out of the mindset that getting rid of a tumor cures cancer.
Yeah,
it
definitely.
Cancer is systemic. So don't buy into all that, oh, if I can get rid of that, I'll be cured.
No.
You won't. That's just a symptom, and that you've got to be very clear on that. And that's why people rush into it. Now, also, I'd spent 6 years of making myself super fit and healthy. When you've got cancer, you're probably on the back foot health-wise. So the last thing you need to do is put your body under a massive amount of pressure with black salve. You've got to be super fit and in really good shape, as you do for surgery or anything else. Absolutely. Unless it's urgent. Similarly, if it's a massive tumor, your body is going to be under massive pressure. It's a huge wound. And also for your immune system to deal with something huge like that, you've got to have a really robust immune system.
Absolutely.
I mean, I was very fit, very healthy, but it knocked the stuffing out of me. It absolutely wiped the floor with me.
This is a poultice. This is a poultice, but it's surgery. It's surgery, isn't it? You remove it.
It's absolutely surgery.
The antibiotics.
And your immune system is working at 1,000%. So you've got to be strong enough to be able to take that. So if you're not in very good shape and you've got a huge tumor and you start doing it, what I found over the years is so many people have called me up without researching, without preparing, gone straight into black salve because they heard about it somewhere, and then phone me up because they're halfway through it, they can't deal with the pain. What are they going to do? And then they're really ill. They've just been diagnosed. They go straight out and get the salve, and then they're in a bad place. Everything is about educating yourself and preparing yourself and having a backup. You know, I had two surgeons that were backing me up. One's a friend of mine and the other one was my consultant, who said, you know, for God's sake, let me see photos and tests so that I can see what's going on. He couldn't stop me doing it because I'd already started it, but he was still there if I needed emergency surgery.
So like I do with people, I always say to people, look, you built a body conducive to cancer over a 6 to 10 year period, then it came out in you. And what I'm going to do today is build you a body conducive to health. That's what I want to do, especially if you've had all, and I'm going to get you straight now. You've really always been trying to build the body conducive to health. You then remove the tumor. So do you believe as of today you're 100% healthy?
Well, I'm knocking on 64 now, you know, and I'm still above ground.
You're a mere whippersnapper.
No, but I'm still very, very fit, healthy. I'm still above ground. I had 2 blood tests a year, comprehensive blood tests. Everything is totally normal to my satisfaction and to my GP satisfaction. My consultant's now retired. So there we are. What I did do, though, I will say one last thing about the tumour. I captured the whole thing and I put half of it in another histology pot of formaldehyde, and I gave it to my consultant who had it analysed at the hospital at the time. And I've got the histology report from that, which showed that it was dead, necrotized tumour tissue with no viable cells. And he said to me, oh, well, I've seen everything now.
Now all this is in your book, The Topic of Cancer.
No, the first half is in my book. The black salve part is coming out in another book, but this first book is the most important one because to get rid of a tumour is the final stage. It is not the first stage. In my experience and from everything I know, that is not, to me, is the first stage to go through. Get your body as anti-cancerous as possible. So I wrote a manual which still goes all over the world. It's for everyone. It's not about treatment. It's about what to do. It's got 10 chapters, 10 things in each chapter, and it's for anyone who's been diagnosed with cancer and their friends and families, and how to go about asking questions, whatever treatment you choose, how to make those decisions, how to ask those questions, and how to do the research. And I can show you the book. It's designed. This is not a big sales thing. I don't make money.
No.
It just pays for another reprint because I only get small reprints. It basically shows you piece by piece. There's recipes in there. There's dietary information on the diet that I went on, which is basically 10 things to stop eating and drinking, 10 things to start eating and drinking. It's got photos in there. It's also got interviews with my team at the back, it's got medical interviews with everybody in there, including my consultant, Dr. Andre, and the other people that have helped me with that. So it's basically whatever stage you're at, you can go into the chapter that you need. So the first one is, I've just been diagnosed, where do I start?
Well, funny enough, the very first edition of Everything You Need to Know to Help You Beat Cancer, which is 17 years ago, exactly what it was. It was 50 questions you're going to ask. You know, like, 50 questions. If the guy's sitting in front of you and offering you chemo, is a whole chapter on chemo. This is what I need to know, you know. And that's what I did. My criticism of my own book is that I've moved, as I've learned more, it's got bigger and bigger. And I actually want to kind of go backwards a little bit and get more. Well,
that's exactly it, Chris. And that's why I wrote this, for people in a state of shock.
Yes.
Because this is where you start. Say, don't finish here. But just when you're in shock, just have a quick, like, oh, right, I've got to go to the hospital. What do I need to ask? 10 questions to ask. Yeah. But I've got the links at the back to Cancer Active, and to other resources where people can get further information when they're out of that state of shock and want to look further into it. The book that I recommend, there's 2 diet books I recommend, and one of them is The Rainbow Diet. I do corporate health.
Rainbow was the kind of natural. It was 2005. There was only one research study. We've now got 95 research studies. It's unbelievable. Cancer Active is a funny one, really, because I'm trying to get to the bottom of it. We've just won some award for being the most informative UK cancer charity, and you think, well, we should be really got 2,500 pages on there now. I mean, it's incredible.
Absolutely,
really.
Absolutely. And what I like best as well is there's the research links on there, because Mr. Kissing asked me to contribute to a book that they're writing for, breast cancer specialists. It's a medical book, and he said, would you do a section in there on integrated and therapies and alternatives with the research links? And your books, and you've got lots of credits in it, of course, where my resources came from. But I've got a lot of information from that. It's been really helpful.
Yeah. Okay. All right. Well, look, thank you for telling your story, and thank you for talking to us about IBC and black salve and things like that, because people are very interested. I really do wish you all the best. I'll see you post-COVID when I come over, and between now and then, have a lovely Christmas, and thank you very much for joining us.
Can I just say one thing?
Please do.
Whatever happens, don't allow fear to make your choices. If you're feeling fearful, that's not the time to make a decision. And fear isn't real. It's simply imagining the worst. It's not happening now. Just stay absolutely present. I've written a whole chapter on that mental attitude, 10 ways not to be afraid. We all feel fear, but don't allow fear to make your decisions.
Well, I feel very strongly about it, in the same way as you do. I was talking to Fiona Shakila Burns.
Yeah, I know.
And I have a kind of favourite quote, which is the Henry Ford quote. There are those who believe they can, there are those who believe they can't, and they're both usually right. And I actually did a speech to about 130 oncologists, and only 3 walked out. And I thought that was the result. And my point was, who teaches you your bedside manner? Because actually the worst thing you can do is go up to someone and say, well, I think, you've got a year. I mean, it's just bizarre. Where does that come from?
That's why, Chris, I'm co-authoring a paper with my consultant called The Doctor-Patient Relationship and Its Impact on Disease Outcome. Because what I am saying, because we've got a clean relationship in the sense that I would say that our relationship was the single most significant factor in my still being here. And I've never had any treatment from him. It's purely on relationship. And what I'm proposing is that patients should be matched with their doctors like in a dating agency, because it will be less stressful for doctors and patients would have a better outcome. Because one of the worst things for cancer patients is not knowing who you're going to get behind that door and how you're going to get treated.
And that you might have a different person every time you go in there at the moment. I mean,
But, and I think not just for cancer patients, for all patients that are on a long-term relationship, potentially long-term relationship, heart patients, stroke patients, type 2 diabetes patients, if we were matched up, the doctors would have a lot less stress, because they know whoever's coming in to see me are patients I've been matched with, or patients who couldn't care less anyway. So that's less stressful. And for patients, to be told, do you know what? We've done, you filled in your form, we've done this. There are 3 consultants or whatever in your area that you're going to get on with. Straight away, the placebo effect on that will be almost miraculous.
I agree. I agree. All right. Thanks for that. Thanks.
Take care, everyone. Look after yourselves.
Okay. Have a lovely Christmas. And this goes out actually about first weekend in December. So I'll let you know when.
Fantastic. Nothing to fear but fear itself. Get on with your life and enjoy your life. Lots of love to everyone.
Okay. Bye-bye.
Bye.